This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, maybe you've had your share of these varicose or spider veins. They can certainly be unsightly, and depending on the person, they can be quite serious. Kathy Stewart says she had varicose veins for 30 years. She says they didn't bother her until a slight bump caused some bleeding.
When I experienced the bleeding part was what scared me, because they had never had anything like that. It was just like a little spout that sprayed everywhere.
That's when Kathy decided to do something about her varicose veins. She opted for something called radiofrequency ablation, an office-based same-day procedure where a thin catheter is inserted into the vein. The catheter emits a high-energy beam that causes the vein to scar down, and then later on the veins at the surface can be removed through small incisions.
I'll talk to a lot of patients who tell me that their legs feel dramatically better after vein surgery, and they didn't even realize that the reason their legs were bothering them was the varicose veins.
This technique has only been an option for just over the last decade. Doctors say you might want to look into it after you've tried non-surgical treatments such as leg elevation. So when do you know when it's time to seek treatment for varicose veins? Experts say watch your skin for irritation, itchiness, and darkening. So now let's talk about a leg problem that's not so obvious, but before we do, we want to set up a scene for you. We're finally starting to break into the milder temperatures, and with spring just about a week and a half away, maybe the only thing on your mind is a getaway. Just one long car ride or flight to get through, and you could be on your way to soaking up the sun. That's the thing. Getting there may be a real pain, literally. You see, all of that time sitting can very easily result in something called deep vein thrombosis, or DVT. According to the Centers for Disease Control and Prevention, DVT is when a blood clot forms in a deep vein. The clot can form for several reasons, but a main one is immobility. It's usually in the lower leg, thigh, or pelvis, but can also occur in your arm and can cause serious illness, disability, and in some cases, death. DVT can affect anyone. In fact, the CDC reports 300,000 to 600,000 people are affected by the condition each year. Among people who have had a DVT, the CDC reports 1/2 will have long-term complications such as swelling, pain, or discoloration. Perhaps the silver lining to all of this, though, is that DVT is very much preventable and treatable. Just have to know when there might be a problem. So joining us today to help us figure that out is Dr. Doug Wilhite, a vascular surgeon with Peninsula Regional Medical Center. Thank you so much for joining us
Thanks for
today.
having me.
First of all, I want to ask you, how and when do these clots occur?
Really, there's about one DVT occurring every 6 minutes in the U.S. And they occur most commonly, like you said, when patients are immobilized. A lot of times we deal with it with the surgical patient population, but also the long car trip, the plane flight, especially in somebody who may be a little bit older or at higher risk for DVT. Those are the patients where you worry about this forming.
Are there other risk factors in addition to immobility?
Injury, again, that's where we come back to the surgical patients, and some patients that have genetic factors or a family history of forming DVT. Those are the patients that are at highest risk.
All right, so what are some signs or symptoms that we might want to look out for?
The classic signs are pain, swelling, excessive warmth or redness of the extremity, and some patients will actually be able to feel a cord or a hard vein where the clot's forming.
Okay, and you can feel that clotted vein. Chest heaviness?
If embolization, the most concerning risk of DVT, occurs, that can cause shortness of breath, chest heaviness, or even syncope or passing out when it's severe.
Okay, so let's talk about that a little bit. DVT can lead to something called pulmonary embolism, which can be fatal.
That's correct.
How does that happen?
Yeah. When clot first forms, it's a very watery or liquidy substance. We compare it to like grape jelly, and so it can break off and travel through the circulation. All the veins lead back to the heart, which leads directly to the lungs. So if that chunk breaks off and travels, it can end up in the lung, where a small one will cause difficulty with breathing, but a large one can actually block flow out of the heart and cause more serious problems.
All right, so how can we avoid that?
Again, it's all about moving. We talk about, for those long trips, doing the heel raises or the toe circles to maintain that blood flow in the veins. If you're taking a long trip, make sure to get out of the car every 2 or 3 hours and walk around for a few minutes just to promote that vein flow, that healthy circulation.
What about the support hose that you can purchase? Will they help?
They're a great product, yes. They do help with that vein circulation. They help reduce swelling or stasis of fluid in the legs. Even the over-the-counter products for just kind of the regular trip or for regular leg swelling, over-the-counter products are great. For more serious leg problems, there's prescription garments that really help out.
Okay, so we talked about prevention. What happens when you do get a DVT? How do you treat it?
For the most part, we treat a lot of patients with blood thinners, medications that help prevent the clot from growing anymore so that the body can then get rid of the existing clot. For patients that have very severe clots or clots in certain locations, we actually do procedures where we'll clean the clot out or suck it out of the vein to help restore flow through that vein as quickly as possible.
Anticoagulation?
Exactly,
Yeah.
Anticoagulation.
Okay, thank you so much, Dr. Wilhite. Dr. Wilhite just mentioned anticoagulation therapy, which can reduce your body's ability to form a blood clot. Jimmy, you have more on that.
Yeah, Lisa, clots don't just form deep in the veins. As a matter of fact, they can occur throughout your body. So it's best to know how to treat them when it happens. So joining us today is pharmacist Samantha Bryant with Peninsula Regional Medical Center. Thank you so much for coming in.
Thank you for having me.
So it's not just in the deep veins that they can form. Where else can this happen?
This can occur anywhere in your body, really. But your arms, your legs. Clots can break off from the heart and go up to your brain and cause a stroke. So they can really occur anywhere.
Cause some serious. Now, Dr. Wilhite mentioned anticoagulation therapy.
That's right.
Explain that to me.
Anticoagulation therapy is really medications otherwise known as blood thinners.
Okay.
And some common examples would be things like warfarin or Coumadin is very popular, or enoxaparin, otherwise known as Lovenox, are some common options that we like to use. There are many other newer agents out there on the market, but all of these medications are used to treat and prevent blood clots from forming.
Okay, I want to ask what may be a silly question, I don't know, but I don't, how does an anticoagulant work?
These anticoagulants or blood thinners work by not necessarily, they don't, based on their name, you would think they would thin the blood,
Right.
but they don't, and they don't dissolve an existing clot. What happens is that they prevent the clot from getting bigger, and they prevent new clots from forming.
Oh, okay.
Yes.
So now, are there people that should be on these anticoagulants?
Absolutely.
Like who?
So first, there's 3 different categories of people that should be on a blood thinner. So patients that have a clot that we want to treat,
Right.
then patients that we want to prevent those clots from getting bigger,
Okay.
and then patients that are at increased risk for clotting. So those patients would include patients that have a variety of heart-related conditions like atrial fibrillation,
Right.
which is a fast heartbeat, patients that have a mechanical valve, heart valve placed, patients that have heart failure or unstable chest pain can be included in this. In addition, patients that have peripheral vascular disease, so that's when there's a blockage or a narrowing in an artery in your leg.
Yeah.
And then patients that have inherited blood disorders as well can be affected and increased risk for clotting. And then we have patients that have cancer, patients that are trauma patients that have some sort of injury that should be on anticoagulation.
So you need to know your
Yes,
situation.
you do.
So there are risks with anticoagulants. Like what?
Bleeding is the main one. So all of these, when you're taking them, can increase your risk for bleeding, especially in areas like your nose, your gums. Women can have excessive menstrual bleeding.
Yeah.
You can have bleeding in the urine or feces. In addition, you can have vomiting of blood that's bright red or looks maybe dark brown like coffee grounds. So we suggest that anytime that you have these symptoms that you contact your doctor right away.
And there are people that need anticoagulants. Are there other options? I mean, you went through a whole laundry list there. How about aspirin?
For patients that cannot tolerate blood thinners, aspirin may be used. Obviously, the blood thinners would be a better option for them,
Right.
but aspirin can be effective for those who cannot tolerate blood thinners, for sure.
Okay, so bottom line, I am concerned about this. What's the best thing for me to do?
You want to contact your doctor right away, obviously. There are lots of options for you, and the best treatment really depends on a number of factors.
Yeah.
Including your kidney function, your age, your weight, whether or not you're pregnant or have cancer, a lot of different things. And so it's not a cookie cutter situation. It really depends on a lot of different things in terms of choosing the best treatment for patients.
Is genetics, does that fall in there anywhere?
Absolutely. So people that have inherited blood disorders have an increased risk for clotting and
Yeah.
may need to be on therapy.
All right. Pharmacist Samantha Bryant, thank you so much for the PRMC.
you.
Appreciate the information this afternoon. Now, if you'd like to read more about what Samantha or what Dr. Wilhite discussed today, or if you'd like to know more about DVT or anticoagulation therapy, all you have to do is go to WBOC.com and click on her picture at the top of the page.